Everyone, today we are started exterior and inferior of the clavaria. See this diagram. Is the exterior part of the clavaria. Its frontal bone, coronal suture, parietal bone, sagittal suture, lambdoid suture, occipital bone, parietal foramen. See this next diagram. In this diagram you see inferior part of the frontal bone, frontal crest, hair present, and see frontal sinus, grooves of superior sagittal sinus, and this is the granular fovuli, this is parietal bone, and this is the arterial grooves, and this part of the grooves of the superior sagittal sinus, and this part of parietal foramen. If we talk about exterior and inferior of clavaria, the external surface of the clavaria is relatively smooth. Unlike its internal surface, is it defined by the frontal, parietal and occipital bones, which are interconnected by the coronal, sagittal and lambdoid suture. The smooth external surface is interrupted by the parietal foramen, which passes to the parietal imaginary vein. The internal surface of the clavaria also bears a number of pits and grooves. The granular fovuli, small pits in the inner surface of the skull caused by the scalar protrusion of the arachnoid membrane. Because this membrane covering the brain, the grooves for the superior sagittal sinus, a dural venous sinus of the brain. If we see next point, see this point, the arterial grooves which marks the positions of the arterial vessels of dura mater, such as the middle meningeal artery, which supplies most of the dura mater and overlaying bone, the frontal crest which give attachment to the falx cerebri, a sickle shaped fold of dura mater between the cerebral hemisphere. If the frontal sinus in the frontal bone is also visible in the interior view. See this diagram. You see frontal bone, occipital bone, parietal bone. It's a diagram of exterior of the clavaria view from above. See this diagram. This diagram sensitivity of the inner table to trauma. The inner table of the clavaria is very sensitive to external trauma and may fracture even when the outer table remain intact. Look for corresponding evidence on CT images. I'm talking about diploic vein in the clavaria. This is the frontal diploic vein, and this is the anterior temporal diploic vein, and this is the posterior temporal diploic vein, and this is occipital diploic vein. So the diploic vein are located in the cancellous or spongy tissue of the cranial bone, and are visible when the outer table is removed. The diploic vein communicate with the dural venous sinuses and scalp veins by way of the imaginary veins, which create a potential route for the spread of infection. See this diagram. This diagram is about the scalp of the clavaria. In this diagram mainly show scalp and dural sinuses and diploic vein, imaginary vein, and outer table, and diploe and inner table. Note the three-layer structure of the clavaria consisting of the outer table, the diploe and the inner table. The diploe has a spongy structure and contain red blood forming bone marrow with a plasmacytoma, malignant transformation of certain white blood cells. Many small nests of the tumor cells may destroy the surrounding bony tubercle, and radiographs will demonstrate multiple lucent area. Punched out lesions in the skull vessels called imagery vein may passes through the clavaria to connected the venous sinuses of the brain with the vein of the scalp. See this next diagram. This diagram is about imagery vein of the occiput. In this diagram, mainly superior sagittal sinus here present, and external vertebral venous plexus, condylar imagery vein, mastoid imagery vein, occipital imagery vein, confines of the sinuses, parietal imagery vein, transverse sinus, and sigmoid sinus. Imagery veins establish a direct connection between the dural venous sinus and the extracranial vein. They pass through the performed cranial openings such as the parietal foramen and mastoid foramen. The imagery veins are of clinical interest because they may allow bacteria from the scalp to enter the skull along this vein and infect the dura mater, causing meningitis. So our exterior and inferior part is finished. Now start base of the skull external view. See this diagram. In this diagram, mainly you saw occipital view, occipital bone, parietal bone, foramen magnum, parietal bone, inferior nasal concha, vomer, teeth, maxilla, zygomatic bone, frontal bone, sphenoid bone, temporal bone of zygomatic process, temporal bone of squamous process, squamous part, temporal bone of tympanic part, temporal bone petrous part, mastoid part. A part is the bone of the base of the skull, so its inferior view. The base of the skull is composed of a mosaic like assembly of various bone. It is helpful to review the shape and location of these bone before studying further detail. If we talk about B diagram, see this diagram of B part. In this diagram you see internal carotid artery, and this is temporal bone of petrous part, and this is carotid canal, its middle cranial fossa, its cavernous sinus, its fibrous fibrocartilage, sphenoid sinuses, its foramen lacrum. So if we talk about this diagram, so this diagram is relationships of the foramen lacrum to the carotid canal and internal carotid artery. Left internal view, the foramen lacrum is not a true aperture, being occluded in life by a layer of fibrocartilage. It appears as an opening only in the dried skull. The foramen lacrum is loosely related to the carotid canal and to the internal carotid artery that traverses the canal. The greater petrous nerve and deep petrosal nerve pass through the foramen lacrum. See this diagram. In this diagram you see transverse palatine suture, its palatine bone, here. It's greater palatine foramen here. Lesser palatine foramen here. It's a warmer pterygoid process of a middle plate. This pterygoid process of a lateral plate. This foramen oval. This foramen spinosum. This foramen lacrum. This carotid canal. This jugular foramen. This is jugular foramen. Stylomastoid. This stylomastoid foramen. This is hypoglossal canal. This foramen magnum. This inferior nuchal line. This is the superior nuchal line. This is the supreme nuchal line. See their side. Its external carotid, its external occipital protuberance, its parietal bone, its mastoid foramen, its carbonyl canal, its mastoid incisor, its mastoid process, its occipital condyle, its styloid process, its mandibular fossa, its pharyngeal tubercle, its temporal bone, its zygomatic arc, its inferior orbital, its zygomatic bone, its concha. This is concha. Its maxilla, zygomatic process, and these are teeth, and maxilla palatine process here, and it's a incisive foramen. So if we talk about the basal aspect of the skull, the inferior view principal external features of the base of the skull are level. Note partially the opening that transmit nerve and vessels with the abnormalities of bone growth. This opening may remain too small or may become narrowed, compressing the neurovascular. If the structure that pass through them, if the optic canal fail to grow normally, it may compress and damage the optic nerve, resulting in visual field defects. The symptoms associated with these lesions depend on the effect opening. All of the structure depicted here will be considered in the more detail in subsequent pages. In next class we will study about base of the skull of internal view. Thank you.